this is the most important thing when you're talking about, when you're trying to get into nursing. Hello, my name is Jeremy. I'm a paramedic and current nursing student, and welcome to The Real Truth. Like, comment, and subscribe, and hit the notification bell. It really helps out with the channel, and let's go ahead and jump into the video. Super important tip, before we go into any of this right here, you have to basically, depending on what school you're going to, you have to know the curriculum, because so you don't end up wasting your time and basically getting the most out of it. But let's start with the paramedic. So in order to go with the paramedic, for community college purposes, you would have to get your first responder, which consists of just getting your CPR and learning how to lift the stretcher and pretty much driving the ambulance truck, and a little bit of first aid. Then the next one, you can basically do the EMT, which is a semester long, where they go over like first aid, a few medications like oxygen, activated charcoal, and pretty much like small sugars to basically bring up the blood sugar. And knowing when to call for the paramedic ALS, because they work on a basic life support level, and they go into the aspect of pretty much helping out and assisting the paramedic. So, but that's the precursor for that's what you need before you can even apply to paramedic school. So, and you don't necessarily need anything else outside of that for that. But if we go into the aspect, once you have your EMT, you go into your paramedic. So from the community college aspect right here, they require you to have human anatomy and physiology 1 with the lab. And then you can basically sit in the paramedic class and go with the first semester. I believe that within midway of the first semester of paramedic school, you would have to have your EMT in order to continue the program, because it is a requirement. So at that point, you're already in the program where you go into paramedic 1, paramedic 1, paramedic 2, and paramedic 3. Paramedic 1 and 2 goes into things like the pharmacology, pathophysiology. It goes into the head to toe assessments. It goes into the needle decompressions. That can go, and like the first semester of it is a refresher of the EMT, because you need to be able to do a head to toe. You need to be able to talk to the patient in order to get information and go from there. Second semester goes more into meds. The third semester can go into either ACLS, PALS, and PTLS, and then also go into like ride times, which is pretty much the paramedic internship. So the requirements, for EMT school, you have to be 18. You have to do your first responder, get your EMT license, then take human anatomy and physiology, and then you can start your paramedic certification. It varies too, because there's some schools out there. Me personally, I went to a vocational school, and I just had my EMT. I was able to jump into paramedic and just go about my day with it right there. But for the community college aspect, where you have all your credits, you would have to do anatomy and physiology 1 in the lab. So for that particular area, you have to check with whatever school you basically decide to go with. Now, the importance of this is that now I'm going to go from the paramedic requirements to the nursing requirements. For the paramedic, if you want to finish off with, you can technically get your license, not have a degree, and do one more semester and have an associate's degree. That in order to have that associate's degree, it's English composition, fundamentals of speech, and college algebra. And then you have your credits to have your associate's degree right there. So that finishes up the paramedic. And the purposes of this video, when I move on to the nursing, we're going to keep it at the associate's degree level. So now we're going to move on to nursing. I emphasize this to you right here. This is the most important thing when you're talking about, when you're trying to get into nursing. Specific classes that you're taking. Because if you go to a community college and you're saying, I'm doing this class, and there's some academic advisors that will lead you astray. You got to do your own research, so you're not wasting your time, resource, and money. So with that being said, here are the classes that you have to take for nursing school. So you have to take English Composition 1, English Composition, Fundamentals of Speech, Critical Thinking and Ethics, Human Growth and Development, College Algebra, and this is the tricky part right here. For Miami-Dade College, you have to take chemistry for health sciences and chemistry health lab. Me personally, I was previously a pre-med major, but then I stopped abruptly because I wanted to have more income and not be that broke college student with a bio degree. But I already took my chemistry, so that was a harder chemistry, so they accepted that credit. So after that, you would do anatomy and physiology with lab 1, and anatomy and physiology with lab 2, and then microbiology. Okay, so let me break this down a little bit. It seems like a lot, but it is necessary for the nursing aspect. You need English composition because you need to basically know how to write up reports, and you need it with the paramedic as well, but you have more time with the patient. You need fundamentals of speech because you need to be able to speak with the patient. You need to be able to teach the patient. The only way you can basically do that is if you're able to speak to the family member and the patients in order to go from there. Critical thinking is everything in the nursing program. So you can have 4 right scenarios, but you have to prioritize which one's most important right now. Just because another thing is right doesn't mean it's not the right thing to do right at this moment. You still have to do it, but it's a build-up. Chemistry, it goes more into the aspects of labs. So you need, like up to a certain extent, chemistry is, like your potassium levels, your white blood cell counts, your sodium levels, your magnesium levels. All these levels plays a part in your electrolyte balance. So to have a general idea of that, it makes sense for it to actually to know it to a degree. Anatomy and physiology, you need to know that and have a good foundation of anatomy and physiology, because it will come back to you when in the program where you have to basically go through pathophysiology. That pretty much lets us know, like the anatomy and physiology and microbiology lets us know what is normal. The pathophysiology lets us know, oh shit's going downhill. We got to figure out what to do to fix it. When you can recognize disease, you can figure you're halfway basically there to find out a way to treat it, and that's the basis of nursing with that. So, all right. So back on track. We're gonna go into the curriculum itself of nursing. So the curriculum of nursing, it goes into different aspects. It goes into fundamentals of nursing with lab, and then it has health assessment, which is the physical assessment, like your head to toe, cranial nerves, that type of whatnot. Basically, learning like vital signs and learning how to speak to the patient. And then it goes to the med math, to make sure that you are able to calculate the medications that you get, into the patient, so you don't kill the patient. And then after that, it goes into medical surgical. So what medical surgical consists of is just picture anything that comes into the hospital that needs to be admitted. That's med surg. It could be recovering from a cardiac arrest. It could be recovering from a stroke. They all come eventually to med surg. If you have to be admitted at some point before you're discharged, you're probably going to end up in a med surg unit. So that's the reason why they say that, like, once you're done with nursing and if you work a year in a med surg floor, you're kind of well rounded because you get a little bit of everything. Then after that, you have your pediatric nursing. That's pretty much kids nursing. That's more complicated than you basically think. And then it's obstetricianal OBGYN nursing, which goes into that whole aspect of mother-baby, labor and delivery. And then there is psychiatric nursing, and then there's med surg, like advanced med surg, which goes into the critical care aspect of what I mentioned earlier. hanging drips on critical patients, doing chest tubes, cleaning, suctioning trachs, which is pretty much the tube that goes inside of the side of their throat whenever they can't get an airway in. If they can't intubate you, which is putting the tube down your throat and going inside your windpipe to force you to breathe when you've collapsed, they go directly to that airway right here. That's in extreme circumstances, but that's what trach care will basically do. And advanced med surg goes into that aspect, and then it finishes up with professional nursing leadership. So both of these both the paramedic and nursing route, when you complete these courses, you have to take like an exit exam, and then you take your state license. Once you take your state license, and then you're pretty much good to go at that particular route. So there is different variations that you can go about. I know for the paramedic, there's a paramedic to RN transitional program that's pretty much like a year. You can choose to do that. I believe nurses, if they get their EMT license, they can challenge the paramedic license. So you can basically go from there if you needed to. So that's about it. At the end of the day, you really need to basically check with your college and check with the curriculum so you don't waste your time. I hope this information was useful towards you. I want you to make sure that this information doesn't lead you astray, so you can get straight to the point. If you have any more questions and stuff in regards to this, you can just comment below and like, comment, and subscribe. More content on the way. Let me know if there's going to be more content on the way.